Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University. And I'm pleased to provide the public health update with data accurate as of December 1st, 2022. This week, I'm going to address a question that's been on a number of people's minds, which is, what is a tripledemic and should we be concerned? The reason people are paying attention to this is because there have been a lot of headlines talking about a tripledemic. And so the question is, what is it? Well, it's not anything, actually. We know an epidemic is a widespread occurrence of a disease in a community at a particular time. A pandemic is simply put, is an epidemic impacting multiple countries. But this idea of a tripledemic is supposed to be the confluence of COVID-19, seasonal flu, and RSV, respiratory syncytial virus. I'm not a big fan of it, not just because it's grammatically clunky and somewhat difficult to say, but also because there are other infectious diseases, right? There have been 29,000 cases of monkeypox. There's been 31 cases of measles in Ohio. There are a lot of other diseases that could be included, and we could have a quadridemic and a quintademic and whatever goes on beyond that. But let's take a look at those three diseases and see what they suggest, because the real concern isn't exactly where we are right now, but what's going to happen to these three diseases. Will they overwhelm our healthcare system? Well, we've been following COVID now for a couple of years, and for the last 8 months, we've been running somewhere between 300 and 400 deaths a day. Now, we're not near the peak. The peak historically has been in late January, early February. So we'll have to keep our eyes open and see what's going to happen there. We have been following hospitalizations, and it looks like in the elderly, those 70 plus, there may be a slight uptick in the last couple of weeks, but we'll keep an eye on that. But generally, things seem to be pretty level. Now, that's not necessarily a good thing, right? Because there's still, this last week, there were 335 deaths a day, 3,300 hospitalizations. So, it's still a serious disease, still one of the top 10 leading causes of death in our country. But there's no evidence yet right now that we're going to see the winter spike, though I suspect most people believe that we will. In terms of seasonal flu, it's been reported that seasonal flu is up across the country. The CDC reports at least 6 million people have been sick. 53,000 have been hospitalized, almost 3,000 deaths. And these are all estimates at the low end. And what we've been looking at is this respiratory illness report. And you can see that this year we've started earlier and we've gotten higher quicker. So we'll see if this leveling off continues. But if it doesn't, we can expect to have a pretty serious flu season. In a typical average year, we have about 36,000 flu deaths in the United States. The question is, this year could be worse or not. In terms of where it's happening, again, still largely in the South, a little bit now more in the Southwest than what we were seeing before. Respiratory syncytial virus, RSV, is something we don't talk a lot about. It's a big deal for us in pediatrics, but not for the general public. But there's multiple non-hospital visits, many hospitalizations in children, mostly under 5, and those over 65, 6,000 to 10,000 deaths in an average year for the adults, and 100 to 300 deaths a year in young children. What worries us about RSV this year is we're seeing this early spike. It's coming up much earlier than in previous years. This as last week's, and the reason I put this up, as you can see, last week we started to see this downward trend, but in fact, that was simply an anomaly. And if you look, once last week was completed, the numbers have actually gone up. So I wouldn't pay much attention to that low green dot. I would pay attention to this trend, which right now is showing us very high rates of RSV, and which does not bode well for hospitalizations. So what is a tripledemic, and should we be concerned? Well, whether it's COVID or flu or RSV, we're still watching what's evolving. We're just getting to that season of the year that's cold, where we tend to be inside, gathering more in the holidays and shopping and so on. We can expect to see respiratory diseases spreading, but we should never forget that there are plenty of other diseases and conditions out there. The best we can do is to be as healthy as we can, get vaccinated for COVID and flu. There is no current vaccine for RSV, but that's the situation that we're in. A great deal more information about a variety of public health issues is on the website. Please feel free, as always, to share these videos with anyone who might be interested. And you can go to the website and see all the previous weeks of updates on the topics that we've covered. I'd like to thank Dara Young for editing, producing, adding captions, and posting this video. And as always, I really look forward to your questions. I answer them either by return email or in a future update. So until next week, please be well. Thank you.